Morning, Minister. I appreciate your time and the opportunity to speak to you about the impact of crime and criminal justice during the COVID-19 pandemic. Today, as one of your key advisors, I will discuss how social groups such as the police, prisoners, and black and minority ethnic groups were affected during the pandemic. COVID-19 has proven damaging to world society, claiming numerous human lives and posing a significant threat to public health. The police were having trouble determining what was guidance and what was law. The fixed penalty notices that were introduced have show how they occasionally faltered in applying new legislation, which reinforced long-standing disparities with black and minority ethnic groups. Prisoners were a population that didn't get any assistance and had to live in appalling conditions, and BAME communities got unfair treatment, alongside black and minority ethnic women facing more domestic abuse and wait for justice. This presentation will begin by identifying what evidence is available regarding how social groups have been affected. Following that, an explanation for why the problem arose will be discussed. Finally, three possible policy solutions will be provided to you, one for each social group, and what may be done to help the situation, with a specific focus on one policy that I believe you should pursue. So, Minister, the problem can be seen here as the police were enforcing fixed penalty notices, which exacerbated long standing inequalities towards a black and minority ethnic community. Fixed penalty notices appeared to be used disproportionately against black and minority ethnic individuals during COVID, with black and minority ethnic individuals 54% more likely to be fined under the regulations than white people. Black and minority ethnic individuals accounted for 15.5% of the population in England, and yet 22% of the fixed penalty notices under the regulations were received by people identifying as black and minority ethnic. As a result of the already heightened tensions between black and minority ethnic communities and the police, it is likely that any strategy of explaining and encouraging is destined to be met with resistance, resulting in a fine being issued. Additionally, between March 27th, 2020 and June 20th, 2021, 177,213 fixed penalty notices were issued in England and Wales. There were 252 wrongfully issued fixed penalty notices, and some people were paying them to avoid criminality, and those who could not afford them, such as the black and minority ethnic communities, risk going to court for more severe penalties. Furthermore, confusion over guidance and legislation lockdowns was highlighted clearly when you were permitted to leave your house to exercise locally. However, local was very different for individuals depending on where you resided, which again caused confusion and led to policing being conflicted. Minister, I'm going to just demonstrate to you why I think the point around prisons is very important. Ashton 2020 highlights that 81 convicts had been released in England and Wales during lockdown, 55 on temporary release, 21 due to pregnancy, and 5 due to compassionate reasons. Many of the remaining 80,000 convicts in prison were forced to live in highly overcrowded, unsanitary circumstances where they typically shared cells as prison officials urgently tried to limit social interaction in workshops, schools, canteens, and shower areas. In March, family visits were cancelled alongside education and rehabilitation processes, which are deemed to be effective for certain prisoners, which led to more complaints of violence, self harm, and suicide attempts, particularly among the young offenders. A study funded by the Economic and Social Research Council across 11 prisons, named Coping with COVID in Prisons, research found COVID response measures led to periods of prolonged solitary confinement across the prison population, resulting in dramatically increased levels of anxiety and depression. The survey key findings included 85% of the surveyed prisoners were confined to cells for 23 hours a day for the majority of the lockdown period. 59% of surveyed prisoners had not had a single family visit during the COVID lockdown. Depression and anxiety scores were approximately 5 times higher than the average for the general population, according to common wellbeing screening instruments, further reinforcing the state prisoners were left in during COVID while assistance was not present. The figure on the slide reinforces how the cases and deaths in prisons during the coronavirus had been on the rise, which is a cause for concern, and policies, which I will be talking about further into the presentation, need to be implemented to reduce this. Moving on, increases in the rate of the reported domestic violence during the pandemic for black and minority ethnic groups had been widely reported in many countries. In the UK, women's crisis support services had received more calls and web based inquiries since the beginning of March 2020 when lockdown was introduced. Structural inequality was present, which reproduces disproportionality across diverse communities and exacerbates existing racialized inequalities. Black and minority ethnic women and girls facing lockdown with an abusive partner or family member found themselves in an increasingly tense and dangerous situation, with few options for space or outside support. The isolation requirement of the COVID-19 crisis increased the likelihood of sexual violence against partners in the home. Reliance on web based support and information services increased those trapped at home, with perpetrators unable to make private phone calls or arrangements to leave. Survivors already going through the criminal justice system process also face extended delays to their cases as the court system effectively shut down. Further issues included the lengthy delays and backlog of cases for the criminal justice system, which was at a stunning rate of 500,000 cases from the magistrates and crown courts, which meant that there was huge delays faced by survivors subsequent to the case having been charged. COVID-19 has exacerbated what was already an unacceptable backlog pre-lockdown, with too many victims waiting years for their cases to get to trial, which means that they could be waiting for years to get their justice. The government is responsible for this backlog, and the only way to improve this injustice is to increase resources in the court system. This slide will show how the problem exists for each social group during the pandemic. In late March, when the government rushed a bill to enforce emergency powers, Prime Minister Boris Johnson instructed people to stay at home as a national lockdown was introduced and new coronavirus regulations were introduced without parliamentary scrutiny or approval. This was evident to be a legislative shortcut where laws had been amended with little to no parliamentary scrutiny, which in turn led to misinterpretation for the public and police. Police officers, alongside the public, struggled to keep up with the many changes in COVID regulations. The rules were reportedly modified 65 times in just 9 months. There have been many new announcements, which included the 4-tier system, face coverings, curfews, local lockdowns, exercise, travel, and exercise restrictions, just to name a few. The uncertainty police officers faced in enforcing all the different COVID rules caused chaos and was problematic when the public tended to look to the police during stressful situations with the expectation that they are the voices of authority, calm, and guidance. But even with the wording of some of the documents, much of the initial COVID guidance about lockdown sounded pretty straightforward. However, this was conflicting and open to interpretation, not least by the police, who had to make some really difficult decisions on how laws could be implemented. As it pertains to prisoners, the prevailing fear was that they provide an ideal environment for the virus to spread, especially given the incidence of overcrowding. The risk of contracting COVID-19 can be lethal for prisoners, and experts quickly realised that the growth in prisons had the potential to be disastrous. Furthermore, compared to the general population, prisoners have broad health inequalities. Prisoners often have complicated numerous health needs as well as a high level of social disadvantages. Because of the physiological, psychological constraints of incarceration, elevated levels of violence, lack of access to health services and support, and greater exposure to disease, incarceration can worsen and compound these health inequities, alarmingly showing how much help the prisoners needed during the pandemic. Prisoners during the pandemic were ultimately a forgotten group. Even though they had committed a crime, they are still human beings. It was evident this social group was forgotten, and care was little and far between. More emphasis and care is needed in the future towards prisoners who we hope one day can be integrated into society once again. Organisations supporting black and minority ethnic women and girls who have experienced sexual assault, domestic violence have now reported significant increases in the demand for crisis support, and more chillingly, what really has spiked for women's organisation is reliance on web-based support and information services. Because while strapped at home with perpetrators, women could not make private phone calls or decide to leave the house in the way they may have done pre-pandemic. This move to digital provision leads to excluding certain women in particular. Women from low income backgrounds, elderly women, and women who have support needs to access technology, including language barriers, are really suffering. There's been a major delay with the courts and receiving justice quickly as cases have been pushed back, which makes the victim feel much more unsafe and reduces the impact of a sentence. Now I will recommend three policies, Minister. To begin, in regards to prisons, the early release program would decrease the jail population by 3,000 for early and this would prioritize these 3,000 individuals alongside prison staff for early COVID vaccination. It can be used as a policy response to lessen the impacts on convicts. By taking these actions, non-dangerous offenders can be released, the burden of overcrowding would be relieved, and inmates may have their own quarters to stop the spread of COVID-19 and keep safe. The police. The police should place emphasis on clear rules that don't leave guidance up for interpretation, as well as a defined strategy for cooperating with local governments and the communities they serve. The local interpretation and regional lockdowns caused inconsistencies and reduced confidence in the police. In times like COVID, when public confidence is required, policies that were approved more clearly would have allowed officers to perform their duties more effectively because they would have known what constituted instruction and what constituted legislation. As a result, they will be able to effectively enforce the laws that have been set in place and police in accordance with the law. In regards to black and minority ethnic groups, Nightingale courts could be introduced where legislating to double the sentencing powers were available to magistrates from 6 months to a year, which would free up an estimated 2,000 extra days of Crown Court sitting time each year, which would be unbelievable for how many court cases could now be looked at. There has been an investment over £250 million to support recovery in the courts in the last financial year, plus over £50 million for victims and support services. This will tackle backlogs and reduce waiting times so justice can be provided quicker. The government does have a plan in place to employ more staff to help clear this backlog when conditions allow. Finally, Minister, the policy I would like you to pursue is the earlier intervention program. This policy would reduce the problem of overcrowding and prioritize the safety of high-risk individuals such as pregnant women. 3,000 electronic tags have already been purchased which have not been used, which we now can utilize. There can be plans to release non-dangerous prisoners who are close to the end of their sentence and pregnant women who are at risk and need to be released as soon as possible. As a result, releasing 3,000 prisoners would help free up the space and help prevent the spread of COVID-19. Furthermore, most prisoners awaiting trial in England are not dangerous. Only 25% of those on remand are facing charges of murder, rape, and other forms of violence. The government could release many of the rest under supervision and allow them to live free until the day it could get around to organising a trial. Furthermore, this allows prisoners to rehabilitate back into society and is much safer for them as they wouldn't be in the overcrowded setting, so they are less likely to transmit the virus. And this places emphasis on a group that has been forgotten about, who deserve a chance to be safe. Thank you so much, Minister, for your time today. I really, really appreciate it, and I will be eager to hear back from you soon regarding what I have put forth today, regarding the policies I have introduced to you, and the evidence that I have put forth. Thank you so much for your time again. I will look forward to hearing from you again soon.